Hello, this is John Kanellopoulos from Athens, Greece, Clinical Professor of Ophthalmology at NYU Medical School in New York. We're going to see a fascinating case, femtosecond laser assisted refractive lenticule extraction. You can see here the applanation with this magnificent device by Zeiss named VisuMax. We're applanating the patient's cornea, centering the visual axis. The patient is following the green blinking light, and now you saw suction coming on. The device is capturing the cornea, stepping on the pedal, creating first the inferior refractive incision, and then following that, starting reversely from center to periphery, the superior incision, anterior if you may, which as you see is wider, and then the smile vertical incision at the 12 o'clock position, 50 degrees in angle, from which we'll enter to remove the lenticule. After thorough training by the Zeiss team, and I thank him very much for that, I was able, this is one of my first cases, to go in with this disposable single-use spatula and find the space over the superior incision, and then go to my right here, which is obviously the patient's left side, and find the space, very important, inferior to the deeper inferior refractive incision. And you can see how the lenticule edge is seen over my spatula. Going in now with this olive tip reverse edge of this spatula and creating the superior to the anterior incision space. You can see the anterior incision is wider than the inferior, so I will try with gentle movements here to generate the space, and definitely go peripheral to the inferior refractive incision. Make sure there's no tags remaining there. Now I'll enter the space that I generated initially under the deeper inner refractive incision, and I'll go all the way through to the inferior part of the refractive incision, find my way through the anterior incision here, and go gently from side to side. I do not want to free the refractive lenticule at any given side, because then I will have no traction to continue my removal. I'll leave the towards my incision adhesion of the cornea collagen tags left behind by the femtosecond laser assisted last. And now the lenticule is free. I'm removing it, and we're seeing the same process in the other eye. Final movements, and as you can see here, lenticule is out. I'm trying to avoid to use a second instrument, and what's impressive is the procedure is done. Patient has very low discomfort. This is the first postoperative day, very impressive result. Pristine cornea, a remarkable large optical zone. 20/25 plus the first day. You can see the OCT image of the stromal interface. No vertical incision like in LASIK, a brilliant case. And thank you very much for your attention. This is John Kanellopoulos signing out.